Well, you're tuned into the big story on the BDTV Breakfast Show. This is where we discuss key issues shaping our nation and economy at large. My name is Elizabeth Musa. Today we'll be exploring the deepening crisis in Nigeria's health sector through the lens of medical tourism. Despite repeated promises to revamp Nigeria's healthcare system, many of the country's top political leaders continue to seek medical treatment abroad. This recurring trend raises serious questions about the quality, accessibility and public confidence in our local hospitals. This is more so as the death of former President Muhammadu Buhari in a London clinic last week has sparked fresh concerns over the huge forex being expended by Nigerian leaders to access medical services abroad while local hospitals are left almost in ruins. Now, this morning we examine why our leaders bypass the system they govern, and what does this mean actually for the average Nigerian? Well, joining us to unpack these issues and so much more is medical doctor and health policy expert Dr. Olufemi Babalola. Is the former president of the Guild of Medical Directors, and he joins us to unpack these issues today. Good morning and welcome to the show, Dr. Babalola.
Good morning.
Good to have you, sir. So in your view, what really is the reason why Nigerian leaders are consistently and persistently, if I may add, seeking medical treatment abroad? Is it a matter of trust? Is it a matter of capacity? Or is it something else?
Well, first of all, let me say that it is a shame that our leaders keep going abroad to seek medical intervention. To me, any leader that is worth his salt should take pride in the medical facilities that he has put in place at home. And no matter how good or bad it is, he should avail himself of the facilities that are on ground, because that is a real test of his mettle, it's a real test of his achievement as a leader. One of the main things that any leader of any country should take care of is the health of the population that he purports to lead. And if you are not confident in your own doctors or in your own health facilities, then shame on you. So to me, it is it's distressing to see that this continues to happen all the time, that our leaders will rush abroad to Paris, some of them go to Germany, some of them go to London, to receive health care.
Former media aide to the late former president Muhammadu Buhari had said, and I quote, he said his boss would have long died if he were receiving treatment locally. In your own opinion, will you say that this is a vote of no confidence in the system and also in Nigerian medical personnel, or is it something else?
Yes, it is a vote of no confidence in the Nigerian medical system by the head of state. You know, what really distresses me most is that even the diagnosis of his problem, or the problem for which he's going abroad to be treated, is not even made known to us in Nigeria. Whatever the problem, so there's a lot of speculation as to what the problem is. Some people say it's an ear infection, some people say it's a GIT infection, some people say it's this or that. We don't even know exactly what the problem he's being treated for is. The first issue is that we need to know exactly what his problem is as a nation. Then we'll begin to see, okay, if he has this problem, why is it that we cannot treat him locally? Why is it that we cannot treat him in our own country? Is it that we do not have the equipment that we need to treat him? Or is it that we do not have the training to treat him? Or is it that we do not have the personnel or the setup, then we now begin to tackle these problems one at a time and ensure that whatever is needed to treat the head of state is available in country, and that other compatriots who may have a similar problem will also be able to utilize the facilities to avail treatment for whatever condition it is that he has. I remember a couple of years ago, the former head of state in Russia, Boris Yeltsin, he had to do a quadruple bypass on his heart. Normally, the Americans were the best at doing that quadruple bypass. But what he told his people was that, look, if we cannot do this surgery in Russia, then let me die in Russia. So what they did was that they got the best Russian cardiovascular surgeon, who incidentally had trained in America, and they told him that he was going to have to perform the surgery in Russia. That would have been the first time they would perform that surgery in Russia. So what this Russian did was to send for his teacher, who was an American, a professor in America, to come over to Moscow. And they went over the case together, and they decided this is what they were going to do. But at the end of the day, the American surgeon was not even allowed into the theater, although he was around. He was not allowed into the theater. And the surgery was successfully performed, and Yeltsin was okay. And this is the kind of attitude we want our leaders to have, so that they take pride in their own country, and they take pride in what the country can do. And they show the citizens that they're really concerned about, making things work within their country.
All right, Dr. Babalola, I'll come back to ask you how much you think this impacts public morale and faith in the local system, because obviously the Nigerians, they're people that just because of the fact that they see their leaders, leaving the shores of the country to access healthcare, it gives them there's really no hope, in the healthcare system, because you're seeing the people that should be leading you, the people that should be making you believe in the system, moving out for healthcare. But, coming from a medical perspective, are there conditions that will truly require treatment abroad, or do you think that most could actually be handled here with the right investment, perhaps?
Yes, to be honest, there's no condition that we should not be able to handle locally in Nigeria. Because I know for a fact that most of the facilities that are needed for advanced surgery are already present in the country, whether it is facilities to do open heart surgery, or facilities to do heart transplants, or facilities to do kidney transplants, or, name it. And as the former president of the Guild of Medical Directors, I actually take pride in our members who have invested heavily in some of these items that are needed to carry out advanced interventions. And even though some of this equipment may not be available in government hospitals, there are many private establishments, particularly in Lagos and in Abuja, that have facilities to handle most. I won't say all, because obviously there will still be one or two things that we have not been trained to do. But I would say probably over 95% of interventions and procedures can be handled in country with the kind of investment that have been made, particularly in the private sector. So most of these things can be handled. Nowadays, for instance, kidney transplants are routinely done in Abuja. and in some hospitals in Lagos. Most in vitro fertilization procedures are done in Lagos. Most interventional cardiology procedures are done in Abuja here and in Lagos and in some centers in Port Harcourt as well. Sometimes the limitation has to do with ourselves as a people, particularly when it comes to transplants. People, we still need to develop that culture of being our brother's keeper and donating, organs for people to transplant. For instance, as an ophthalmologist, I know that we could be doing corneal transplants freely in Nigeria, but unfortunately, people don't donate their corneas even after they die. They say they want to carry their eyes to heaven with them or whatever. So, but so these are just some of the limitations that we have. Otherwise, the expertise is there and the equipment is there to do, I'm sure, up to 95% of what is done abroad.
But sir, some might argue, actually, you talk about we're still dealing with problems of electricity, we're still dealing with, the non-payment of salaries or underpayment, so to speak. So you find out that most of the best hands are, we are facing what we will call a brain drain, because most of our best hands are leaving the shores of the country to access, better. Perhaps they will actually leave the country. So let's talk about what can be done, because if you could just give us a sense of just how much damage the medical tourism by public officials has done to, Nigeria's efforts to build a functional healthcare system, because perhaps you are trying, maybe the healthcare, maybe the doctors are trying, but because of the fact that the people that should actually be pulling all their weight, they're actually leaving. So they are leaving the country to, medical tourism, like we call it. And that now brings us back to the situation that we're facing, where if knowing that there needs to be work done here, they know that they have no choice than, like that woman I'm speaking about, that is trying to give birth to a child, and is going to the worst place that no one should even find themselves in that place in the first place, trying to give birth. Perhaps if they know that they have no options, then they will do well for the healthcare sector here. So let's talk about, the damage that has been done to actually build a functional healthcare system. Do we still have Dr. Babalola?
Some of our healthcare facilities. Yes, I'm here. Can you hear me?
Oh, okay. We didn't hear you for a bit.
Can you hear me?
Absolutely, we can. We can hear you.
Sorry,
Please
I'm
go
sorry
ahead.
about that. Maybe. Can I continue?
Please go ahead, sir.
Okay. All right. So I was saying that the quality of our healthcare system leaves much to be desired in many aspects, particularly, I have to say, in the public sector.
Dr. Babalola. All right, just before the slight technical challenge, Dr. Babalola was speaking about, the fact that the quality of the healthcare sector leaves much to be desired in the country. People are grappling for the best of healthcare, but obviously there's a challenge that we're facing. Okay, please carry on, sir. We lost you for a bit.
I'm sorry about. I'm so sorry about that.
All right.
That's one of the gremlins in communication. So I was saying that the quality of the health care facilities we have, leaves much to be desired, particularly in the public sector. And many hospitals are challenged in terms of, the cleanliness of the wards, in terms of the motivation of the doctors, in terms of the quality of the facilities and equipment that they have to deploy to take care of patients. Most of it is down to poor funding by government. And even if the people who are charged with running the facilities do their best, there's a limit to what they can do, particularly if they don't have the funding that is required for them to run the place efficiently. Of course, one has to talk also about the issue of the motivation of the staff in terms of what they are being paid and how they are being taken care of. As we speak, the salary structure of many of our health personnel is nothing to write home about, and that is why many of our young ones are actually, as soon as they graduate from medical school or nursing school, the next thing they're looking for is how to go abroad so that they can get some kind of good quality of life for themselves. I'm aware that the Nigerian Medical Association are in talk with government as to how the remuneration of the medical doctors can be improved upon and made something that is realistic given the economic situation in the country at the moment. And these are fact issues that government has to face head on if we want to improve services in our health sector. Now, somebody who is already struggling to make ends meet comes to the hospital and has to treat a pregnant woman or has to take her through delivery. The frustration that he's already coming to work with, it's not unlikely that he will bear, transmit that frustration to the way he's going to deal with the patient. So obviously we need to make sure that our health personnel are happy and they're well taken care of and given salaries that are meaningful in today's economic climate. Having said that, I have to also say that on the other end of the scale, we do have facilities that are world-class, particularly in the private sector. Even in Abuja here, for instance, some brand new hospitals have been built by multilateral corporations, which are world-class. And if it is a matter of our leaders wanting world-class facilities to get themselves treated in, they are actually available here. I was from what I heard, the hospital where our former head of state was treated was the London hospital. I don't know whether it's accurate or not, but I have been to that facility before. And really, some of the things we have in Nigeria, some facilities we have in Nigeria, they were much better than in terms of the physical appearance, in terms of the array of equipment and facilities, than what they are able to offer there. And the irony, of course, again, is that maybe even when it gets there, it may be a Nigerian doctor that is going to treat him when he gets there, because quite a high proportion of the high-end health personnel in the United Kingdom are actually, Nigerians.
And that's really a sad fact.
Yeah, it's a sad fact. I mean, that our head of state will leave Nigeria and then go and meet another Nigerian over there who's going to be the one to treat him. And of course, any head of state should ask, why are you here? What are you doing here? Why are you not helping us at home with your skills? And he will get the predictable answer he will get is that, number one, government is not investing enough in healthcare. Number two, the salaries are not anything to write home about. And perhaps he may also talk about issues concerning security and all these other things. So these are the multifaceted issues that we face. But, the idea is, do we really want to face these problems head on? Some people have suggested that, the best thing to do is to ensure that no government official is sent abroad on taxpayer money for treatment. If a government official wants to travel abroad on his own, that's okay. But to spend taxpayer money, to take care of them and pay their bills, it's just unfunctionable. Any dollar or pound that is spent abroad to treat any government official is a missed opportunity at home. That dollar or pound could have been invested, in our own facilities here to get something that will be of use,
Right.
not only to that particular head of state,
Okay.
but also to all other Nigerians who may have the same problem.
All right, Dr. Babalola, just because we are pressed for time, you did mention something that brings me to my next question, because we're really talking about, people in public office going for medical tourism. So in your opinion, do you think that there should be any laws that could be passed to limit public office holders from seeking treatment abroad unless under extreme conditions? I don't know if this is a reach, but do you think there should actually be any laws, limiting public officers from seeking treatment abroad?
Yes, certainly. There should be laws limiting public officials from accessing health abroad on taxpayer money.
Right.
Obviously, if they have a public official who has money by himself or herself and wants to avail treatment abroad, we can't force him to stay, and avail treatment in Nigeria. But if the person wants to go on taxpayer money, that's when the law should hold that. Look, okay, Mr. Suzo and so you have this problem and you want treatment abroad, good luck to you. It has been estimated that every year we spent about $1.5 billion from Nigeria to access healthcare abroad. And that will include diverse places like India, United Kingdom, United States, Germany, and so on and so forth. I can imagine if that $1.5 billion was invested locally in our hospitals, it will be extremely transformative, and we will have such an impactful, it will have such an impact on our healthcare facilities.
All right, just my final question before I let you go, Dr. Babalola. What lessons can we learn from other countries, in terms of practical steps that can be taken right now to restore confidence in Nigeria's health system, not just for the masses, but also for the elite? What lessons can we learn from the global stage?
Well, like I said, I know for a fact that countries where they have a modicum of pride in their nation, they do not. I mean, their leaders don't just travel abroad, to access healthcare abroad. When did you last hear that the head of state of India went to London to treat himself? Or the head of state of Pakistan? These are third world countries, just like Nigeria, and it's not just in healthcare alone. Take, for instance, the cars that are bought by officials in Nigeria. I remember when Obasanjo was head of state, when he was military head of state, not during his last incarnation, he made it compulsory that all official cars had to be made in Nigeria. And everybody was riding around in their 504 and maybe 505, maximum. And we were doing it with pride, even down to the clothes that they were wearing officially. They said everybody should be using the low profile, and everybody was going to work in their Ankara proudly. It's the same thing they do in India. You know, the cars that they use for government must be made in India. And the clothes they wear usually are Indian products. That is the only way to develop a country. If we say that our leaders can just run abroad when they have a slight cough, a slight headache, then we're not going to develop. We're going to remain just the same way we are. So I want to urge our legislators and leaders to pass that law to make it impossible for people to travel abroad on taxpayer money to access treatment. So that's the only way we can know that, okay, we have to be serious about our health care, and then we concentrate on doing the needful to raise the level of care we bring to our people.
All right, thank you very much, Dr. Babalola, for your submissions this morning on The Big Story. It was truly insightful. Thank you very much. Well, this has been The Big Story here on the BDTV Breakfast Show. My name is Elizabeth Musa. Up next is the social listening segment. Do stay with us.